So normally influenza follows a seasonal epidemic. So we would see cases start to increase around April, May. And so we get vaccinated usually around March, April. And then the peak of the influenza season would normally occur around August, September, and decline around October, November. But that's not to say that there's no influenza in the rest of the year. Sometimes we do see quite a lot of influenza in the summertime.
And in a usual year, how many cases are there and how many deaths are there in Australia?
Oh, it really depends. Some years there's a lot more influenza circulating than in other years. So like SARS-CoV-2, influenza is a notifiable disease, and we do see notifications in the hundreds of thousands some years.
Right. And so, for example, in 2019, before the pandemic started, what were some of the worst years as examples?
Yeah, so 2019 was a very long, protracted influenza season, but 2017 was a quite severe season in as much as there were quite a number of deaths. There were quite a number of high-profile outbreaks in residential aged care that resulted in deaths among our elderly. And there was also high hospitalisation rates around the country.
And so did it basically disappear over the last couple of years?
Yeah, so when we started implementing pandemic mitigation measures around March last year, we stopped people from interacting. And so by doing that, it meant that the virus couldn't jump from person to person. And then in addition, we closed our borders. So the opportunity for new flu viruses to come in and seed new epidemics in the country was completely halted. And so our reference laboratory hasn't been able to confirm flu in a community sample, so in someone who would have just acquired influenza in Australia. We hadn't confirmed the presence of flu since April last year, although very, very recently we confirmed community flu in Sydney. But that's not to say that it will result in an epidemic. There's still a lot of other things that need to happen for that single virus to cause an epidemic. But it does highlight the potential for an epidemic to occur.
Yeah, and so there are going to be a heap more people coming in over the coming months, the next 12 months, as the borders open. So what's the danger, there having not been much flu around at all over the last 2 years, and the likelihood that we're going to see a substantial spike in cases in the coming 12 months?
Yeah, well, if you think about it, we've got around 600,000 children under the age of 2 who've never seen flu. So that's quite a sizable population of young kids who are entirely susceptible. And kids are really important for transmission of influenza. And then for older populations, normally people get infected we actually really don't know exactly how frequently people get infected, but normally there would be a higher level of protection in the community than there is now. And the other thing that happened this year is because the COVID vaccine was being rolled out around the same time the influenza vaccine is normally rolled out, there was a bit of confusion around whether you could get the influenza vaccine at the same time. And so that meant that the vaccine uptake was a bit lower this year than it has been in previous years.
And so what's your advice to people now?
I think people who are intending to travel, it would be a really good idea to get the vaccine if you didn't already get it earlier this year. And particularly for the people who've been stuck overseas and who are returning to Australia, or even people who are visiting Australia, it would be great if they could get the Northern Hemisphere flu vaccine before they come here, just to reduce the likelihood of people bringing flu into the country.
And you specifically mentioned young children there. What's your advice to parents of young children?
Well, flu vaccine is available for free for children under the age of 5. It's supported by the National Immunisation Program. So there's no reason not to get your